Hi, let's imagine together this scenario in your next OSCE exam. The scenario is young male who is presenting with nausea and vomiting. Please take history and outline the management plan. Wow, sounds good. It looks easy. Okay, did you reach the diagnosis? Did you outline the correct management plan? No? Okay. Did you ask if he was smoking cannabis? Is your questions were the direct questions? Did you reassure the patient before asking him? Did you hear about cannabinoid hyperemesis syndrome? It's not difficult. Let's see. First of all, I'm a Dr. Mohanad Abdelmajid. I'm one of the FRCEM Academy courses instructor, and today I will highlight on one of the common station of FRCEM final OSCE, MRCEM OSCE, and it could be area of questions in SBA exams. Let's start with the definition. Cannabinoid hyperemesis syndrome is episodic syndrome of cyclic vomiting in context of prolonged use of cannabis. So that means you should suspect this diagnosis any presentations of nausea and vomiting with a cyclic pattern and where there is associated cannabis use. Okay, next, the pathophysiology. To be honest, the pathophysiology of cannabinoid hyperemesis syndrome is not clearly understood. Why? Because while a cannabis can act as antiemetic at low dose, repeated high dose use can result in vomiting. So they don't know why. Okay, how we diagnose these conditions? Remember, cannabinoid hyperemesis syndrome diagnosis is unlikely to be in ED. So don't try to confirm this diagnosis in ED. It's a diagnosis by exclusions. And unfortunately, most of the time, they will confirm this diagnosis after multiple hospital admissions, after many workup, including imagings, blood tests. So that means sometimes will take months to years. However, personally, I believe the history is the cornerstone of this diagnosis. So take a proper history and keep these features in your mind. If you find one of them or more, that will increase the suspicion of cannabinoid hyperemesis syndrome diagnosis. The features are severe nausea and vomiting that recur in a cyclic pattern over a month. The age of the patients, most of the time less than 50 years old, and at least there is a weekly cannabis use, and the symptoms are resolving after stopping the cannabis use. The symptom relieved by hot shower or bath. There's a history of abdominal pain, and there's a history of regular cannabis use for more than 1 year. And as I mentioned, the history of the cornerstone of the diagnosis. And the most important questions is you have to ask direct questions if they are using cannabis or no. Most of the patients, they are reluctant to disclose this kind of information. Try to reassure them. Try to let them feel they are comfortable when they are answering. Try to explain for them. Their information are very confidential, and you are acting in their best interest, and there is no legal consequence to their answer. Okay, so what the investigation we have to do? The investigation, the general rule for the investigation, follow your local policy for the investigations of abdominal pain and vomiting. Most of the time, it will be full blood count, UNEs, liver function test, and amylase, CRP, and blood gas. And carefully assess the hypoglycemia, acute kidney injury, any electrolyte disturbance, any metabolic acidosis, alkalosis, and rule out any surgical emergency. How should we treat them? So the treatment is symptomatic treatment. So that meaning we should follow the local policy in treating vomiting and abdominal pain. That mean we should consider painkiller, we should consider IV fluid if they are dehydrated, okay, and antiemetic, whatever you are using in your department, cyclizine, ondansetron, metoclopramide, domperidone, okay. However, there is something called refractory vomiting. It's very common in cyclic vomiting. So please consider haloperidol in low dose for this condition. The dose of the haloperidol will be 0.05 mg per kg. Maximum dose is 5 mg and should be intramuscular. And the last point, don't administrate the haloperidol before doing ECG to check the QT prolongations. This was my talk for today. I hope it was useful, and I hope the good luck for everyone. Thank you.